So remind me and the folks here a little bit about what Marigold Health does and who you are.
Yeah, of course. So what we're basically focused on doing is bringing scalable, really culturally competent behavioral health and substance use treatment to your average person that might not necessarily feel like treatment is a fit for them right now. Because when you look at mental health and substance use care, we really got two problems. One problem is most people just aren't seeking care, right? It's not accessible, or if it is accessible, they're dropping out because they're not engaging with it well. But the second problem is that we just don't have the capacity to treat all the people with this problem, right? In substance use, 90% of the people with an addiction aren't getting any kind of care right now. So if all of them had the access to treatment, how would we actually handle that? So our solution is to really use peer support groups integrated with clinical care to give patients a really accessible front end that they can relate with. And on the back end, we use that to basically better focus the time of care managers and social workers.
So peer support groups, folks talking just to each other, person to person, about their mental health. Isn't that a HIPAA nightmare?
So it's all text-based. So it's a text-based chat group. And of course, we have to be HIPAA compliant as a platform. But what's important to realize is that this is already embedded in the psyche of recovery, right? For a lot of patients, they're going to 12 steps or NA groups anyway to seek treatment. And even from a more clinical perspective, 39 states are reimbursing peer support in a face-to-face context. You've got special plans now set up in New York that are HART plans, right, with specific money set aside for peer-driven interventions. It's really born out of necessity, right, because we don't, A, have the behavioral health infrastructure to treat all these patients, and even if we did, that might not necessarily be the best way to engage a lot of these, very marginalized communities, frankly.
And there is a value there. People like to hear from people or to interact with people who are going through the same thing they are. How do you kind of moderate these forums? How much do you step in to control what people are saying to each other or how they're interacting?
Yeah, well, that's a great question, right? I mean, it's all good on paper until, it's like on Reddit where someone on Suicide Watch tells someone else to go kill themselves. So what we've actually done is we've built AI tools that understand the emotional sentiment of what's being said in these chats. So we white labeled this product and we're working with community behavioral health providers, behavioral health care management teams, and they're on paper the ones facilitating these groups. They're onboarding patients, they're using this to engage their existing patient population. But they don't have to read every single message manually. We'll kind of pick out the things that are most clinically relevant and then use that to focus their attention.
And then how does the peer support element fit into the other parts of Marigold Health?
So the core of Marigold Health is really focused on just giving patients this text-based peer support group. And why that's really important is for behavioral healthcare to actually work, right, you need to give patients an environment where they'll talk about their deepest feelings and emotions and insecurities. And we're not focused on delivering any kind of content or delivering any kind of forum or feed-based approach. We're giving patients a text-based single-thread group chat. And we're using that and we're tracking how that affects retention in normal outpatient care. So it's a very low cost, but fundamentally very accessible wraparound service for already at-risk patients.
What's the route by which patients find their way to Marigold?
So normally they're onboarded by their existing provider. So a really common use case for us is someone being discharged from an inpatient psychiatric unit, right? Being integrated with the community is going to have a care manager assigned to keep in touch with them. And the issue there is it's just really hard to generate the touch points with these patients. So they'll be onboarded with Marigold as a resource, branded under their provider as they're discharged, or as they're coming into outpatient, we can also onboard them at that point. We're selling directly to the provider.
So real quick, how far along are you with this process? How many patients are using it? How many organizations are you working with?
Yeah, so we started this company about 2 years ago. My background was I was an EMT and a firefighter before I was doing this. We first went to about a dozen different community nonprofits and peer recovery centers to really prove out the core model. And now we're live at about another half dozen clinical sites. So that ranges from some inpatient psychiatric facilities to these kind of community behavioral health providers that I mentioned. And then our research partners are at Hopkins and Brown, and we have some NIH-funded studies going on right now to validate the more clinical aspects of the platform.
All right, real quick, what's next?
What's next for us?
Yeah, either on the technology side or in the deployments.
Well, we recently just closed our first venture round, so we're growing our team pretty dramatically. So right now we're very specifically looking for a UX designer, but we're growing our whole product team. So if you're interested in really scaling the future of behavioral healthcare, we'd want to hear from you.
Great, thanks so much.
Thanks, Jonah.